Professional misconduct, infamous in conduct. Infamous conduct, ethical misconduct, ethical negligence, ethical malpractice is that of a medical man which would be reasonably regarded as disgraceful or dishonorable by his professional birthright of good repute and competence. Certain features, strictly speaking, professional misconduct should include only those for action which are no punishment in IPC or any other existing civil or criminal medical register council of India and can take action by removing the name of the doctor. Dichotomy, putting up an extra large big signboard, employment of touts. However, the list of professional misconduct issued by the Indian Medical Council Professional Conduct Etiquette Ethics Regulation 2000 includes many acts for which there are punishment both in asking sexual favors from a patient in return for treatment. The sexual misconduct may considered as a criminal offense in IPC 375. However, having a complete consensual sexual intercourse with the patient without any fear, force, or fraud is not an offense. It an infamous conduct according to ethical principle laid down the above regulation. Insurance of a false medical certificate is an outright criminal offense as well as ethical misconduct. List of professional misconduct. Indian Medical Council professional conduct etiquette enumerates some instances of professional misconduct. It is an important remember that a list of this nature can never be complete and exhaustive, depending upon the circumstances and even acts not mentioned in the list may be taken as example of infamous conduct. Adultery or improper conduct or association with a patient, conviction by court of law of offense involving moral turpitude, issuance of false certificate, a report and other document, association with unqualified person, contraventions of drug act and regulation, selling a scheduled poison to the public, performing an illegal abortion or enabling an unqualified person to perform an abortion, issuance of a certificate of efficiency in modern medicine to unqualified or non-medical person, contributing articles to the lay press and giving interviews regarding disease and treatment which may have the effect of advertising himself, a solitizing practice. But it is open to him to contribute articles which educate the public about hygienic and healthy living and also to give a public lectures on health. Using an unusually large signboard, it is also improper to affix a signboard or a chemist shop or in places where he does not reside or work, disclosing the secret of his patients obtained in the exercise of his profession to others, except when bounded by law. The subject is dealt with later under the headings professional secrecy and privileged communication. Refusing treatment on religious backgrounds, publishing photographs of his patient in any medical or other journal by which his identity could be made out without first obtaining the consent of that patient. However, if the identity of such a patient is concealed, the consent of that patient is not required. To be sure, no patient under this condition could be sue the doctor either because he did not have a way of knowing it was his photograph, publicly displaying his fees except in his consulting room, using touts or agents to procure patients, receiving or giving commission or other benefit from fellow doctors, traders, chemists, manufacturers, etc., giving of commission by one doctor to another for favor of recommending or referring the patient to him is known as dichotomy or a fee sharing or a fee splitting. Talking despairingly about other colleagues or doing anything that means unfair competition. Lack of eagerness to respond in emergencies. Not attending a patient which is already under his treatment. Addiction to narcotic drugs, alcoholism, using unsterile instrument, or not furnishing his patients with the proper information about drugs or diet. Covering assisting someone who has no medical qualification to attend, treat, perform an operation, or some person in cases requiring professional skill. Running an open shop for the sale of medicine. Write a prescription in a secret formula known to some particular pharmacy only. Commercialization of a secret remedy, accepting any gift or travel facility, etc. from pharmaceuticals companies. 6 A's of a serious professional misconduct. Association with unqualified person, employment of fraud to procure patients, Advertising. It is improper to use an unusually large signboard to advertise oneself. Adultery. Arising out of a professional relationship. Abortion. Unlawful abortion and includes prenatal determination of the sex, then inducing abortion. Addiction. Addiction to drugs or doctors supplying drugs of addiction pethidine to addict. Case study. British General Medical Council cancelled the license of Peter for 6 months as prescribed hallucinogen to a patient, although it is used as a drug for a drug addiction in some countries. It is unlicensed in UK. Alcohol, seeing patient under the influence of alcohol. Punishment and disciplinary action, professional conduct, etiquette and ethics. If a medical practitioner is found guilty of any of the offences, his name may be erased from medical register, either temporarily or permanently. Professional death sentence. Thank you.